Hello and good morning, and welcome to our roundtable discussion on fentanyl overdoses in children. My name is Amanda Ruback, and I'm the Community Outreach Coordinator here at the Missouri Poison Center. And with me today, we have 5 great experts in their fields. First, we have Dr. Jamie Condis. She is a child abuse pediatrician at St. Louis Children's Hospital and Associate Professor of Pediatrics. So welcome. And then we also have Dr. Trevor Treadway, who is a pediatric emergency medicine physician at SSM Health, Cardinal Glennon Children's Hospital. So welcome. We have Julie Weber. She is a pharmacist and the director of the Missouri Poison Center, as well as the president of the American Association of Poison Control Centers. We also have Lieutenant John Blaskowitz. He is the Sex Crimes and Child Abuse and Domestic Violence Commander at the St. Louis Metropolitan Police Department. And finally, we have Dr. Frederick Eccles, who is the Acting Director, Commissioner of Health at the St. Louis City Department of Health. So welcome, everyone, and thank you for joining me. The goal of this event is to make the public aware of the dangers of fentanyl overdose, especially in children, and hopefully provide some knowledge of the issue and as well as some prevention messaging. So I'm going to start off today by determining, what's happening. What is the scope of the problem with fentanyl overdoses in children? So I'm going to have Dr. Eccles start us off.
Amanda, thank you for this opportunity to share information with with your audience this morning. Overall, in the city of St. Louis, what we're seeing is an increase in fentanyl use across all age groups. In 2020, there was a 25% increase in overdose fatalities and a 30% increase in non-fatal overdoses. Of those, 57% of the overdoses were associated with polysubstance use, and 80% of those were associated with fentanyl use. Driving the increase in overdoses and overdose fatalities is the African American population. So 73.2% fatalities in 2020 were of individuals of African American descent. 61.9% of those were African American men, and 61.9% were African American, and then 57.3% were African American women. And so we know that the impact of the pandemic really highlighted the issues related to mental health issues and substance use disorder, and we expect to see the numbers actually get worse over time, because we know the impact of COVID-19 has impacted every facet of society, especially individuals' mental health and well-being. And so the City of St. Louis Department of Health is really working to make sure that we're able to support individuals over the upcoming years as they grapple with the impact of COVID-19 and the impact and its influence on their well-being. We know that young individuals are experiencing with medications, prescriptions, and other substances at younger ages. According to data from the CDC, roughly 2/3 of individuals utilize or experience alcohol before the 12th grade. 50% of individuals before the 12th grade reported using marijuana. 40% of individuals who completed their survey reported trying cigarettes before the 12th grade, and 20% reported using medications without prescription. So this is a really dire issue that we have to really establish a comprehensive plan to address.
Thank you very much. Yeah, it's definitely eye-opening to hear some of those statistics. And Julie, do you have anything additional you would like to add in that section?
Absolutely, and I appreciate those statistics, because the National Poison Data System that the Missouri Poison Center data goes into, we're much more of a passive system where we're really not a mandated call to the Poison Center, but our support services are available 24/7 to help with this. I don't believe we see the true impact of all the fatalities, but I do know that just our exposures where we're able to prevent something more significant from happening are definitely on the rise since last year, where we will surpass the 2020 numbers in 2021. I believe really what we see at the Poison Center We're there for prevention, but we see the devastating and the catastrophic outcomes of those children who are surviving these events and what happens. So definitely on the rise, and that's what I'd like to add. Thanks.
Thank you. So you've touched on this a little bit, Dr. Eccles, but is this a new issue that we're seeing in the city and the state, or is this something that's been there all along that we're now just becoming more aware of?
I think it's a little bit of both. I think in certain populations, substance use disorder has been highlighted for several decades. When you look at this Stop the Drug campaign back at several administrations ago. So it's been an issue, but we haven't developed a comprehensive approach to really address it. I think it's been legalized, or so there've been a lot of policies that have been developed that have resulted in in certain populations being further advantaged and being funneled into the criminal justice system rather than really connecting individuals to the resources and services that they need. We know that mental health, there's a lot of stigma around mental health, and so when individuals don't have the proper support that they need, they often result in other activities such as using substances to cope with the stresses of life. And so in the city, one of the things that we're really working to do is make sure that individuals who have mental health, behavioral health issues are connected to mental and behavioral health specialists rather than being connected to police or the law enforcement, because we know what the end result is more individuals in our criminal justice system that then aren't able to really reacclimate to society. And so that creates another set of issues that we really have to work to address. But by doing the work on the front end and connecting individuals to the resources and services that they need, we can help individuals live a better quality of life and contribute to society. But it really requires that the system work together to make sure that our communities are aware of the resources that are available. To Dr. Weber's point, we really need to make sure that all of our communities are aware of the services that the Poison Control Center provides, as well as other services that mental health specialists across the city of St. Louis and the St. Louis region are able to provide at no cost. But the first step is really removing stigma around mental and behavioral health.
That's a great point, and that collaboration is so important, and we have that this morning here with the panel. So that's a wonderful start, absolutely. So kind of switching gears to the actual overdose itself. What does a fentanyl overdose look like in a child, just from the experience you have, Dr. Condas?
Thanks, Amanda. So this has definitely become a big problem for us at Children's Hospital. Our numbers of fentanyl overdoses in children are double currently, just so far in 2021, what we saw in all of 2019. So the numbers have really gone up. And what we're seeing a lot of is really young kids, because it's the parents who are using the fentanyl, but the toddlers, are the very young children, like children less than 4, are getting into the fentanyl and ingesting it. Sometimes the parents are aware that they had access to it, and usually they're not. They just have it stored incorrectly. So that's been a problem that we've been seeing both in our region for deaths, but also just severe overdoses where kids can end up with brain damage and with other long-term effects. So these kids typically present very ill. We see a lot of ingestions in the hospital, and our overall number of ingestions is quite elevated in 2021 as well, where we've already seen more ingestions total than we saw in all of 2019. And a lot of our ingestions just present with kind of mild symptoms like vomiting or lethargy, which is being very sleepy. The children who ingest fentanyl, they get very severely ill very quickly. They often stop breathing while they're still at home, even before they can get to the hospital. They are often they become unconscious very quickly, and they're very, very ill. And I think what a lot of people don't realize is that Narcan, which is a drug used to reverse overdoses from heroin, doesn't really work well with fentanyl overdoses. You need much higher levels of Narcan. So while somebody might be able to revive somebody at home that's overdosed on heroin with Narcan, they often can't with a fentanyl overdose. So we sometimes have to bring these children into the ICU and give them very large levels of Narcan to hopefully revive them. But they get very, very severely ill very quickly, which is why we just don't want to have that overdose in the first place. And it's not even, I don't even want to use the term overdose for young children, because it's just the ingestion. Just very tiny amounts of fentanyl in a very young child is enough to cause them to be very, very sick or die.
Thank you. And Dr. Treadway, do you have any thing you would like to add in terms of what you're seeing in the emergency department?
Yeah, thanks, Amanda. Yeah, I agree, with what Dr. Condis had said. What she's seeing at her hospital, we're seeing the same thing. I'd say probably 10 years ago, we were more worried about the older kids, the adolescents that were getting into drugs. It was more the opioids. Now, we see 1 or 2 kids a month, probably in the last 12 months, with fentanyl overdoses. And these are kids that are under 4 years of age. And so it's not, 10 years ago, we worried about kids getting into fentanyl patches and chewing on them. Now it's more of the parental use of the fentanyl, and the kids are getting exposed just being in the home and things like that. But like Dr. Condis said, the range of symptoms is dramatic. We'll see kids that just are brought in because they're extra sleepy. They're difficult to wake up. Or they just seem a little more out of it. Their gait is abnormal, so they're walking funny. They're just not doing the normal things. But then we see the other kids that come in that are, like she said, it depresses their respiratory rate. So when they stop breathing, it also affects their heart. So then a lot of times their heart will stop. So we've had kids that have come in what we consider a full arrest, where they're not breathing, they have no pulse. EMS brings them in and they're doing full CPR on them. And we will give them Narcan to kind of reverse this, but like Dr. Condis said, fentanyl it's 50 to 100 times more potent than most of the opioids. So it does take a little more effort. So we have a lot of these kids that, we get a pulse back, they do get admitted to our ICU, and they can spend several days in there till they recover. And then depending on how long they were down with lack of oxygen to their brain and stuff like that, we just don't know what the outcomes are. So, but yeah, it is definitely a problem. And again, it's changed because it's not the older kids we're seeing, it's the kids under 4.
And absolutely devastating injuries and death, unfortunately. So what should a person do if they notice or are seeing some signs of an overdose in a child? I'm going to ask Dr. Condis to start.
Well, I think the most important thing is they need to get that child into medical care right away. If they know they have drugs in their home, especially fentanyl, which these parents know if they have the drugs in their home typically, or if they've been around other people who potentially might use drugs, if they've been at a party or a relative's house where there's possible drug use, and then they see these symptoms in their child, they need to come in for medical care right away. This is not something they should wait on, because once the child starts having the respiratory depression or the difficulty breathing, they can go downhill very quickly. I think what parents need to know is that these drugs are just very, very potent, and they're actually, the fentanyl is getting mixed into other street drugs that we're seeing as well. So the parents may be using marijuana or cocaine or other drugs that have been laced with fentanyl. So they may not actually know that they have fentanyl in their home, but they may know that they have other drugs in their home that the children can be ingesting as well. So if they have any thought at all that their child may have ingested something, they need to come immediately to the hospital.
Absolutely. Anything you would like to add, Dr. Treadway, as well, in terms of what a person should do?
No, again, like Dr. Condis said, a lot of times the family might not know there is fentanyl in the thing. We always encourage the families to be honest with us, especially in the ER. There is always the stigmata of it, saying that we do have drugs in the house, but being open with us kind of helps us. We've kind of changed how we practice. We get an unresponsive child that comes in, we're thinking about a fentanyl ingestion or an opioid overdose to begin with first. So, even the parents say there's no signs of drugs in the home or things like that, we still consider that a possibility. But yeah, as Dr. Condis said, if there's concern your child is not acting right and you do have drugs or there's possible drug exposure, getting them to the emergency room as quickly as possible is very important.
Absolutely. We're going to switch gears a little bit. We have Lieutenant John Blaskowitz here on a law enforcement perspective. So what is law enforcement seeing in homes where fentanyl overdose has occurred?
So we're not seeing a particular neighborhood or district. It's happening across the entire St. Louis City region. So it's not isolated to one particular part of the city. With that being said, when we are going in homes, the general home that could be characterized as unsanitary in nature, and just some tips for the general public to look for if you're in such a home is things, drug paraphernalia in particular, micro blenders that aren't used for anything other than mixing the fentanyl agent, typically with heroin in the St. Louis City area. So when you see things like a micro blender, cut straws, spoons that have residue on it, syringes, anything like that should draw to your attention that there's a problem in that home.
Thank you for that perspective. Do you have any numbers that you can share from the child abuse unit surrounding fentanyl overdoses in children?
So our child abuse unit is staffed with 6 detectives and 1 sergeant, and I'm the lieutenant in charge of the team. This year alone, we've handled 151 total cases as a team, but 27 of them are drug exposures. And it's not just limited to fentanyl, it's the overall total number of exposures that I'm sharing with you. But fentanyl is certainly leading the pack in terms of those exposures. And the reason why this is problematic to my team is because in our pyramid of priorities, sexual assaults and physical abuse lead the way because those are repetitive type crimes perpetrated by criminals. The overdose is typically isolated to once in nature, and we have to prioritize that on what we need to investigate. With 6 people, you can imagine that sexual assault and physical abuse are at the top of the list. However, when it comes to an overdose that leads to a fatality, that is the top of the list. Anything that is child related that leads to a fatality takes the highest priority. But when it's 18% of your caseload as a team, it's too high. We really need to focus on the other priorities that I just mentioned.
Thank you for that. And you touched on this a bit. So, but what is the response of law enforcement in these sort of investigations as well?
So our team gets referrals through the Division of Family Services or 911 calls. Once the detective gets the call or the hotline tip, they respond to the scene or to the hospital. They secure the scene, they interview witnesses, and there's multiple steps to interviewing witnesses, especially when there's child witnesses to these type of events. They need to be screened and interviewed by forensic examiners. So we partner with the Children's Advocacy Center and have all of our children that are witnesses to crimes interviewed by them. After that, we asked the guardian who was there with the child for a urinalysis screening. So we notice initially that when we conduct the cursory interview at the scene, most guardians will say no, that they aren't on drugs, that they don't use drugs. And then when we say, okay, we're going to need a sample from you, that's when they're like, maybe I need to tell you something. I do use drugs. And the problem we're having with these investigations and pinpointing how the child was actually exposed is that in a lot of these homes, there's multiple users in the home. So to pinpoint exactly who left the narcotic or substance around, it can be impossible at times. But with that being said, we'll conclude the case by presenting it to an assistant circuit attorney here in the city of St. Louis. And we make recommendations on the charge, which usually leads to endangering the welfare of a child. And then it's up to the prosecutors at that point to determine if we've done enough or if we need to do more follow-up. But the reason why these things take time is the detectives are seeking out medical records, tracking down witnesses, tracking down the suspect who may have left the scene. All of these things take time. And when you're overwhelmed with your caseload, as it is with sexual assaults and physical abuse cases, these cases are slow to come to conclusion. So we are actively investigating 27 on this year for 2021 right now. And that stat is important because we're already over 6 cases ahead of what we did all of last year. So it is a problem, and if we could get the city could get a grasp on it and it would reduce my detective's caseload where we could focus on other things that need attention.
Thank you very much for your perspective. I just want to circle back a minute to just make sure that the audience is aware. What are the signs and symptoms? Let's talk just another minute about that, about what we see when a child potentially is exposed to fentanyl. And I'll ask Dr. Condis just to reiterate that for me. Thanks.
Sure. And again, it can be a range of signs and symptoms. So I think it's definitely something that parents need to take seriously. If there is a potential of any drug exposure in the home, they need to be paying close attention to their kids. It can range from things like vomiting, but the child isn't sick. So unexplained vomiting, unexplained trouble breathing. That's definitely respiratory depression or trouble breathing is really a big one that we see a lot of. Not being able to wake the child up, so the child is excessively sleepy, or the child being unconscious and that being unexplained. So if your child's having any of those symptoms, you should be, one, you can contact poison control, but also just bringing them to the hospital.
Thank you very much. So I know we've talked a lot about some of the dangers and the scope of the issue, but I think for the last few minutes here, I would like to focus on prevention and safety. And so I would love for everyone to join in by giving a couple of prevention tips or things that you might, from your perspective, think we can do to reduce these fentanyl exposures in children. So I'll ask Dr. Eccles to start.
Thank you. So I think one, identifying that mental health and substance use disorder are really should be made key priorities in our jurisdiction, but also making sure that families across all of our communities are aware of the resources that are available for them. And then oftentimes there are root issues that go unaddressed. And so making sure we create an environment where those individuals who are suffering from life stressors have an opportunity to be connected to the appropriate resources so that we can prevent them from going down the road of using substances as a coping mechanism. So I think one, increasing the availability of mental and behavioral health resources, increasing employment, increasing access to other services such as utility and mortgage assistance, which are key issues that we found to be important for families and individuals who are struggling with mental health disorders. We need to make sure those services are readily available and easily accessible to those individuals. We also need to make sure that our providers are able to provide culturally and linguistically appropriate services so that families will trust them moving forward, because rebuilding trust, particularly in our disenfranchised communities, is really important. As we look at the data in the city of St. Louis, a lot of the overdoses and overdose fatalities are in our zip codes that have been stripped of resources, whether it's healthcare resources, financial resources, employment resources. So we really need to reinvest in the communities that are suffering from disinvestment.
Thank you very much for that, Dr. Eccles. Lieutenant Blaskowitz, any tips or prevention messaging you have?
Sure. If families and loved ones recognize that there's an addict who has children that they're responsible for, obviously we'd love for you to intervene and try to get the addict help. But more importantly for us in the child abuse unit, we need to make sure those kids are protected and try to remove those kids from the situation. So they can always call the hotline 1-800-392-3738 and report that family. Those calls get screened and sent to us. And just know that, family members too can go out, and because Missouri has a standing health order that allows them to get Narcan in their hands in the event that it's needed, can prove extremely beneficial, especially in the city of St. Louis, because fentanyl is being cut with heroin, and the heroin aspect alone will be knocked out by the Narcan. So just know that that's an option available to you.
Thank you very much. And Dr. Condis, you're up.
So I think one important thing is for people in the community to just know that this is a really big issue that we're seeing. We're seeing a lot more deaths in children who are small children who are getting into drugs. So, be aware of where you're sending your children. If you're sending your children to a friend or a family member to play or be watched, and they come back and they're having symptoms, be aware that we're seeing this so much in the community that it could be at somebody's house, even if it's not at your own house. And if you do have these drugs in your home, any drugs, marijuana, cocaine, any drugs, be aware that they could be laced with fentanyl. And so make sure that you're keeping those drugs far, far away from your children's reach. But if you see any of these strange symptoms in your child and they've been somewhere out of your home, just be aware that potentially drug exposure could be the possible cause, and you should bring them to the emergency department.
Thank you. And Dr. Treadway?
Yeah, I think just kind of like most of the panel have said, just having parents aware of some of these symptoms or presentations of the kids, and if there's drugs in the home. And like Dr. Eccles said, I mean, we will see the kids and can take care of them. And, if sometimes it's, we're able to reverse that and things like that, but it really is it's a family issue and a community issue that is involved in this. So it's not just the kids. These kids are you can kind of consider them the innocent victims. They're not using the drugs, but they're being exposed to that. And so if we can help the families and resources and things like that, it can prevent the kids from ending up in the emergency room.
Thank you. And lastly, I'm going to ask Julie to answer as well.
Our biggest steps with prevention are to know that the Poison Center is a source that's available 24/7, 365, and it's a totally confidential service where there are really nurses and pharmacists specially trained to answer these questions within seconds. So you brought up about what signs or symptoms that are there. Anytime your child's not acting within the normal, we want you to call. We don't want you to just be at home, go to the internet to ask people. Call the professionals. And I think my call to action is to get that Poison Center number programmed into the phones, 1-800-222-1222. Again, it's free, confidential, and immediately you'll have expert help to say, yes, you immediately need to call 911, or there's things that we can do at home, and to continue to follow up with you and ensure your child's doing okay. It's not just a call and it's over with, but it goes much further than that with our specialist. And then too, it was mentioned about different paraphernalia in the household and just the where you're taking your child into different environments. It's easy for me to say, oh, wipe down the surfaces and that, but it's that simple as if you see residues or the cleanliness in that home, or the powder can be on a table, the floor. And as we think of young children, hands go to the mouth and then we have an exposure. And so it's very essential for, to wipe tables, the sweeping the carpets, the residue. And then lastly, if possible, I talk about this with everything, but we really want to get things out of sight. I know a lot of these exposures happen while the product's in use, but get them out of sight and out of the way of, or the access really of children. And I always say locked items up, but with these items, we know they're out in the homes and they're accessible. So it's that cleanliness and keeping it away. And then always, I just want to urge people to call. We're here, and within seconds, you'll be talking with a professional who can help get you the best help.
Very much. Thank you. So thank you very much to our panel, Dr. Eccles, Lieutenant Blaskowitz, Dr. Condis, Dr. Treadway, and Julie. Thank you very much for your expert information and messaging. It's been great to have so many different fields represented on this important issue. And we really appreciate the audience for watching as well and joining in on our discussion on the dangers of fentanyl overdose in children. Please share this video with on your social media accounts to highlight this important topic. Thank you very much for joining us.